This documentary is dedicated to my family and all those who have passed away due to cancers caused by this gene.
I'm going to fight the fight, until it doesn't make any sense to fight anymore, but you always have to keep your hope.
Cheryl McGee, a devoted wife since her 20s, a nurturing presence in her family's lives, had always prided herself on living well, loving deeply, and taking care of her health. But in the quiet moments of what should have been a peaceful vacation, something fell off.
Pop-Up and I went on a vacation to see Uncle Frank and Uncle Helen in Florida. And we were there for 5 days. And we ate nothing but fresh fish. And I ate yogurt and coffee for breakfast and fruit. So my diet was completely good. And yet, for the whole time I was there, I never went to the bathroom. And I thought that was a little strange. So when I got home, I was uncomfortable, but I got up and went to work the next day.
Back home, her concern grew. Her colleagues in the medical field urged her to contact her doctor right away. When she did, the response was immediate and alarming. Go to the emergency room now. The presumed diagnosis, an obstructed bowel.
And I'd say it was probably about 10 and a half hours later, they came into me, because by now they had done all kinds of blood work, of course. They've done ultrasounds, they've done CTs, and may even have done an MRI. They did enough tests that when they put the whole picture together, they said, you have ovarian cancer.
Ovarian cancer, often labeled the silent killer, rarely shows symptoms until it's advanced. But what exactly is this disease? To understand Cheryl's diagnosis, we first have to understand how ovarian cancer begins and why it's so difficult to detect.
The BRCA genes, named for breast cancer, are tumor suppressor genes. Their job is to help repair damaged DNA inside cells. During cell division, especially in the S and G2 phase of the cell cycle, BRCA proteins act like microscopic repair crews, fixing breaks in DNA. When the genes are working properly, they reduce risk of cancer by preventing mutations from being passed on when cells divide. But when someone inherits a mutated BRCA1 or BRCA2 gene, the repair function is disrupted. This increases the chance that damaged cells will continue dividing, which can eventually lead to cancer. There are two main types of the BRCA gene. BRCA1 is more commonly linked with aggressive breast cancer, while BRCA2, the mutation Cheryl carries, is more associated with ovarian cancer and male breast cancer.
BRCA mutations cause the proteins they produce to become non-functional or absent. Without proper DNA repair, errors build up over time, increasing the risk for uncontrolled cell growth, which is what cancer is. For example, BRCA1 mutations often involve small insertions, deletions, or errors in splicing, all of which prevent the gene from doing its job. In BRCA2, a common mutation occurs in exon 11, a part of the gene known as the ovarian cancer cluster region, or OCCR. A frequently seen error here is the insertion of an amino acid called cysteine at base pair 5382. These mutations are strongly linked not just to breast and ovarian cancers, but also to pancreatic, prostate, and even melanoma in some cases.
BRCA mutations are passed down in an autosomal dominant pattern. This means that only one copy of the gene from either parent needs to carry the mutation for the child to be at risk. If a parent has a mutation, there's a 50% chance it will be inherited by the child regardless of sex. This matters because both men and women can carry and pass on BRCA mutations, and both are at risk for associated cancers. That's why genetic testing isn't just for women, it's for families. There's no way to tell just by looking if someone has a BRCA mutation. That's why genetic testing is essential. This is typically done through a blood test or saliva swab, and it looks for known mutations in BRCA1 and BRCA2. If a mutation is found, genetic counselings help individuals understand what the results mean and what steps they can take next. In Cheryl McGee's case, Her BRCA2 diagnosis prompted her daughter, Cheryl Ann, to get tested too. For many families, this kind of knowledge is the first steps towards prevention.
It's a bit of a shock when you're on the other line of the phone and they say, well, I'm calling to give you your results, and I need you to know that you are BRCA2 positive. It was a lot harder a hill to get up after I heard it, for myself. But then I said, hey, you know what though? This isn't about me. The testing and the monitoring, if you will, that's going to become needed isn't going to be happening for me, but it's going to happen perhaps for some other members in my family. Because when you're talking genetics, it's family-wide. You get lucky if certain things don't come up. How wonderful. But, when you do end up having them and then you do hear it, it has quite an impact to learn it.
Ovarian cancer is often called the silent killer because it rarely shows symptoms until it's in a later stage. Early signs like bloating, back pain, or feeling full quickly are vague and often overlooked. There is no single reliable screening test for ovarian cancers. Doctor may use a pelvic exam, ultrasound, or even a CA-125 blood test, which tracks CA-125 proteins in the blood.
But these only give clues, not confirmation. The only way to definitively diagnose ovarian cancer is through surgical biopsy, which often happens too late. As a result, over 70% of ovarian cancer cases are diagnosed in stage 3 or 4, when treatment is more difficult and survival rates are much lower. Knowing your BRCA status can help you take action before it ever gets to that point. A positive BRCA test result doesn't mean someone will definitely get cancer. It means they have a higher chance of developing it. But there are ways to lower that risk. These include preventative surgeries like a mastectomy to remove breast tissue, or a hysterectomy and oophorectomy to remove the uterus and ovaries. Increased monitoring, including regular MRIs, mammograms, and blood work. Medications that reduce hormone levels to make cancer less likely to develop too. These steps aren't easy. They involve difficult personal decisions, but for many, they provide peace of mind and a better chance of living cancer-free. For Cheryl McGee, discovering she had a BRCA2 mutation was life-changing, but the impact didn't stop with her. It extended to her family, offering them a chance to understand their own risks and make knowledgeable choices. Cheryl's diagnosis also pushed her daughter, Cheryl Ann, to undergo genetic testing. Learning about the BRCA2 mutation in her family helped Cheryl Ann make informed decisions about her own health.
I felt comfortable and confident with it. I didn't do it right away. I actually waited about 2 years to do it after I found out that it was an option, because I was trying to expand our family and wanted to wait until after. I couldn't do anything until after I had my son.
Once tested, Cheryl Ann made decisions, not out of fear, but foresight.
I specifically watched my mom's sister and my mom both go through breast and ovarian cancer. So for me, it was just more seeing what they've had to go through and not wanting to kind of follow that same path and wanting to be more proactive about my own health so that I wouldn't end up kind of in the same boat as them. It was recommended that I have a hysterectomy, and that decreased my chances of developing ovarian or breast cancer by about 60%. So I opted to do that because it was the lesser of the two surgeries that they recommended. They had recommended the hysterectomy, and then additionally they said after 40 I should do the double mastectomy. So I did the hysterectomy after my son when I was 36. My odds of developing breast or ovarian cancer are less than 0.2%.
But surgery didn't go as planned.
I had a lot of unexpected outcomes. The whole process was supposed to take 4 months from start to finish, the way it was outlined in my initial appointments, because my body was rejecting having kind of anything that was unnatural in it. I kept getting pushed back further and further because I would have to address the infections, go through another surgery so they could replace things that were there, and then wait it out again before I could get another surgery. So what was supposed to ultimately be like a 4-month process from start to finish with reconstruction ended up being about 1.5 years and ended with me in the hospital with sepsis for about 10 days. My experience to that point had just been so out of the norm of what we expected and anticipated it to be.
The BRCA diagnosis didn't just affect Shirley's body, it shaped her relationships too.
But I had a lot of really great support in the community at that point, and had my parents nearby, my in-laws, my mother and father-in-law nearby. And so we did have a lot of support with that. And I think that made it a lot easier. When I had the double mastectomy, there were a lot of unexpected things that happened. So I almost felt like I was burdening everyone because I was constantly having to like deal with and pivot in different directions throughout the entire process. And I know that that was taxing on the people, especially in my household, who were having to just consistently for 1.5 years, like have to worry about like my level of just infection.
The process tested more than her health.
I was under an immense amount of just stress. I was trying to balance work, and I'm a student, so I was trying to balance school, and I was trying to balance being a mom and being, doing everything around the house. And I think like until you're in that situation, you don't understand like the level of just stress and anxiety that was constant during that time. And I was just very frustrated and just felt like I was continuously being disappointed with like my health progress. And that just like really took a toll on me.
Now, Shirley shares her story to educate and empower.
I think I took my time and I explored different avenues and different options and talked to different doctors and different health professionals. So I picked what was right for me. I just hope that other people can pick what works for them. Like, obviously I have daughters, and if they have this gene, and I have nieces, and if they have this gene, I would really encourage them to freeze their eggs early in life and just know that they're there, so that if they do have any unexpected ovarian cancers or breast cancers that pop up and it prevents them from being able to have a family, they have that option of other choices that are there, whether it be surrogate or there's just lots of options.
1 in 400 people carry a BRCA gene mutation. Know your risk, know your options.